This video highlights phacoemulsification under topical anesthesia. We are highlighting a flip nuclear phaco chop technique, a single port irrigation aspiration, and IL insertion under irrigation aspiration. Side ports are taken two in number. Then with ocular injection over and into the eye, viscoelastic injection, and a temporal incision with a diamond knife, 2.8. Under the viscoelastic insertion, you are doing anti-clockwise rexis, which is done with a cystotome. 26 number bend needle is done. Support is taken. This cystotome has got viscoelastic anchored to it, so whenever there is a chamber shallowing or your rexis going out, with the same incision you can insect viscoelastic without coming out of the wound. The rexis which is done is 5.5 millimeters and along your pupillary margin border. Once the rexis is completed, hydrodissection and delineation is done with a 27 gauge cannula. You see the nucleus is prolapsing out, you tap it in again. From the other side you will be doing it again, there is a prolapse and you tap it in, fill it with viscoelastic again over the cornea and into the eye. Phacoemulsification is done. Now this is the flip nuclear phaco chop technique, where you have flipped it through the hydrodissection and you're getting into the core of the nucleus. Watch very carefully. With your other port you have broken the nucleus into two halves. The one half again you are making into multiple chop techniques, and with your side port constantly feeding it into the probe. So you're working with a very high vacuum and with a good aspiration flow rate. The nucleus and the epinucleus are aspirated simultaneously. At no stage would you see you are having any of the surge in your anterior chamber. Once the nucleus and epinucleus is aspirated with a bimanual irrigation cannula, you are removing your cortical matter, which is done. The thing we would want to highlight in this is a sub-incisional aspiration which will be done, because with your bimanual irrigation it becomes very simple. So without changing your hand pieces, you'll be able to aspirate all the cortical matter. Here you see sub-incisional aspiration, very nicely done, and from the other port. So your one hand is stabilizing the globe and you are aspirating the cortical matter. Once the cortical matter is cleared, under the same irrigation port, you are injecting a Rayner type hydrophilic IOL, which very smoothly opens up. Your leading haptic is in the back, and the trailing haptic, which is over the iris. You see, we're just getting tapped in by your aspiration cannula. You're removing your cortical matter and filling your anterior chamber with moxifloxacin 0.5% preservative free, diluted to 10 ml, and end of the procedure. Thank you very much.